pass through and find it. The Doppler ultrasound is also one of the way. What will happen? It is one of the easiest one. Because when the patient comes, you put your probe on this and you can diagnose the, you can see the internal organ. Even you can see that is where the patient says, if the period of amenorrhea, the periods are not coming for more than 6 weeks, they may doubt whether the pregnancy or not. So they have to do either blood test or something else. But if you put your probe, you can say easily whether the pregnancy is there or not. So the ultrasound is the observed wave reflected from the moving target. Abdomen is also moving because the organ is also moving. The vessel is also moving. So you can see this one. A frequency of the waves received from which has been transmitted as sound waves into the electrical wave and then to the ultrasound wave. Next one. This is the ultrasound machine. Next one. Now the color Doppler. Color Doppler means there are so many ways. There is one, you have to say whether the arteries or vein is involved or not. That is, if it is the arterial, there is then atheromatous stage, what will happen? There may be a blood may be there. So that will, if you discharge from this, what will happen? It will go and affect the distal area that produces thromboembolic phenomena. That may be one of the cause for the brain ischemia. Suppose if it is a lower one, it will go into the heart. That is also can be possible. So that is, you identify the vessel, whether the normal vessel or abnormal vessel, the vein is there or not. The flow is also identified. Any thrombosis of the venous system also can be identified. Next one. The high frequency wave. The tissue details and anatomical display is the hallmark of this one. So, what will happen? Previously, the extension shoulder was taken. Nothing was seen. Whether the fracture is there or not, whether the air is present or muscle tear is there. But the ligament tear cannot be identified. But with the ultrasound, ligament tear can be identified, and we can see whether the effusion is there. That is also can be identified. Because before the CT development, after this, the probably is not much of an interested area, but it has been done. Next one. Next one. Now you see the closer look of the 4D images is there. This image, if you do in the ultrasound in the pregnant woman, you can see the pregnant part, as well as you can see the real baby, how it has been there. Next one. Are you able to see this one? Oh. Now you can see there is face, eyes, and everything you can see the individual. So you can really see the baby in the 4D ultrasound. Next one. Computer tomography. There are detector systems, just a similar one. The detectors are there. Previously there is so many generations have been there, 4th, 5th generation there. So if the detector is one side, so what will happen? Previously the CT is taking minimum 5 to 10 minutes for each individual. But now the detectors, that is Godfrey Ansel, that is in April 72, it has been the one which has been invented. He has got later the Nobel Prize also. Next one. Next one. Now you see there is the image in the 3rd generation. Now next one. Now you see the 4th generation. What will happen? The detectors is situated at the entire thing. So the previously it is 10 minutes for the abdomen vein. Now you can see even 1 minute or 1 second is enough. Even 3 to 4 seconds we can finish up everything. From the chest to this one, 3 seconds is more than enough. Because of the advent of so many detectors are there. So multi-detector system is the one which will be easy for us to give the images. Images also what will happen. When the scan is there, we can see the images. So there is no lag is also there. We can see whether is there any affected area is there. We can make the patient once again within few seconds. We can make it and repeat it with a slice thickness also. It will reduce. You can identify very clearly. Next. Next. This is the CT machine. Next. Next. This is in our hospital, this is the machine. Now you see the cross-sectional anatomy. Because you see there is the biplanar. Now that is, you can see there is the sagittal section of the images. From here to here, sagittal section. Coronal section, like this it has been there. Axial section to be there. So you have to reconstruct it. You can get a good image. Okay. Now you can see there is the Try next year how it has been there. In this section you see what are the organs it has been. Previously we are not able to see, but at present CT you can see the size and the level of the kidney and what are the things that have been there. Any defect you can identify. But the time or the previous 6 days you may not be able to do it. Next one. Yes, we are going to come. Next one. Magnetic resonance also, some other speakers also going to touch only this one. MRI is demonstrated exceptional utility of immunological images first. First they have implemented only the NET scanner, MRI scanner. But in 1972 to 73, Common General Hospital, this is one scanner, only doing the scanner low. After this only there is a whole body scanner developed. Next one. This is the MRI scan. Next one. Now open MRI is also now it has been used. Open MRI is useful because the test, that is the magnetic strength cannot be much, but they are trying to increase the strength, but how they are going to successful, it will be left with a company people, isn't it? Next one. Now, what are the things you have to see is the, now you are able to see the MR scanner, you are able to see the radio frequency wave and the magnet and radiant coils and the scanner, also you have to see this. So, with this you have to protect this also there, because sometimes in CT everybody can send it, but in the MRI you have to check the patient. Because sometimes what will happen, the radio opaque material, watches, even some cardiac spacemaker and cardiac suture, what will happen, these are containing the metal, what will happen, the magnet will absorb. So what surgery was done, it will be open. So that before this one, patient should be screened whether there is a magnetic resonant material is there or not. If it is not there, we will not do that. Some of the cases, post-operative cases, you want to do MRI, we are unable to do because of that is the radio opaque material containing which will absorb by the magnet. Next one. Now you are able to see the magnet, radiant coil, RF coil, similar thing in the MRI resonance what will happen, it will be body has contained more than 80% is the proton. Among this what will happen, the properties of the proton. This proton what will happen, it has got nucleus of the iris. So which will not affinity towards the magnet. So I don't want to detail discussion. Next one. Next one. So advantages of this over CT is there is no radiation. The soft tissue contrast is also there. Suppose for example CT, whether it is a fluid or a pus, CS of fluid, like this is very difficult to differentiate. But here you can differentiate the fluid and also the tissues, connective tissue, fat tissue, bone density. So every detail, each and every tissue detail can be analyzed and you can give it. There are so many sequences are there. So the T1, what looks it is opaque, that is the radiolucent like appearance. That is otherwise called hyperresonant and hyporesonant. If it is hyporesonant on T1, that may be hyper on T2. So depending upon this it will be there. So it is easy to identify whether the infarct or reinterpret. Next. Advantages and disadvantages. PACS is the most important one, because whatever images we acquire, that will be sent to the PACS. It is not only used by the radiologist and the other people. The entire hospital is also, the hospital information system also it has been connected. You can see from the ward. The first in our stage has been not in the very low medical college, somewhere around 20 years back. Now our hospital has got last year. Now even the ward people from the ward, they can see that whatever happened in the radiology department, they can see the images. Some of the images will show. Now you see this is the angio. Now you see the CT angio. Next one. Previously what will happen, CT itself, if the metal is there, you have to produce artifact. Now the companies have come forward, the artifact less, even though the metal is there. Now you are able to see that no artifact was there. This is MR purography. That is, even the system, whatever be the thing, you can get the image. This is because of 3D acquisition and everything, reconstruction, you can get it. This is MR angiography. You can see the circle of release and everything it can be there without anything except a single port of injection to affect contrast. Otherwise, everything will be filled. Even without this MR, what will happen? MR angiography without contrast also you can do better. Now you are able to see the different images, the spin images, fast spin images, and the radiation. You can see the difference between this, the same page. You are able to see. Next one. Conclusion. The mere observation and hard work is not enough. The skilled assisting people, either by the radiologist or them, and clean observation and experience is the new, the most of the information, rather try a vision alone. Thank you.
You can ask if you have any queries. Anyone? Engineering SRM University to give a talk on lab to Professor K.C.Saravanan. Thank you, sir, for a clear review on practical uses of X-ray and fluoroscopy with a comparison to conventional and modern procedures like angiography, DSA, and PACS. Tea is being served outside the auditorium.
Good afternoon, esteemed faculty, staff, invited guest speakers, ladies and gentlemen, my fellow students. My name is Dr.K.C.Saravanan. I am here to give a short presentation of our speaker, Mr. Dept. Mr. Dept. was a student of Symbiosis Institute of Health Science from the year 2009 to 2012, from which he graduated with an MBA in Hospital and Healthcare Management. He has handled government business from Maharashtra, Goa, MP, and Chhattisgarh. He also has handled private accounts of Mumbai and adjoining. Mr. Dept. with an excellent knowledge of imaging products like CT, MRI, PET, CT solutions, and linear accelerators, with specializations in radiation oncology segment, has, on behalf of Siemens, acted and served as a technical consultant for public-private partnership projects for the government of MP and Maharashtra. Ladies and gentlemen, it's my privilege to make welcome Mr. Dept. Thank you.
Good morning. Firstly, thank you so much for inviting me to SRM to deliver this lecture. And before we start on the main topic of radiotherapy, I have a small video to enlighten you what is radiotherapy all about, what are we dealing with out here. to the contents of my presentation. I'll deal with history and then a few basics, classification, radiotherapy process, treatment planning, and medical equipment associated with it. Now, before we start, we'll just look on how is the process happening. There are different stakeholders here. There's the patient, there is the radiologist, there is the nuclear medicine guy, there is the medical physicist. But the core of the entire process of radiotherapy is the patient. What happens primarily in India that is leading to such stats? I get a lump here on the head and neck area. Head and neck is one of the most usually occurring kinds of cancer. So I get a lump here, head and neck. What do I do next? I bear it for a few days. That's what generally happens. I bear it for a few days. Then I go to the physician. I have a lump here. What do I do? He gives me some sleeping pills and says, go to sleep. That's better than bearing the pain. Still, it advances. It becomes bigger. Then I go to another guy called radiologist. He tells me, do a CT scan. Let's find out what is the matter all along. So I do a CT scan. I see a lump and unusual tissue growing out here. And then the radiologist says, I am sure there's a tumor, but I really don't know to what extent. The function of the tumor is not known. I know the anatomy. That is what a CT gives me. What do I do for the function? I do a PET scan, which will tell me the function of this particular tumor tissue, which is generally more than the normal tissue growing around. So after a PET scan, after a PET CT scan, I come to know this is a cancerous tissue. I need to do something about it. This process has already taken 3-4 months, which are unknown. A small tumor, which may be benign at the time it started, has led to a malignant stage because of ignorance. Because of this huge gap that I really don't know how to cover. So after I'm diagnosed, what do? I go to radiotherapy guy, or go to brachytherapy, or I take surgery, or I do several ways to get rid of the tumor. To that stage, which is generally happening for around 60% of cases in India, when they go to this stage, they already come to know I'm at terminal stage. There's nothing much can be done about it. And that's the sad story. That's the sad story of India. That by the time we come to know that something really wrong with us, the time has lapsed so fast that we really can't do anything about it. So we want to discuss about the same, about different techniques of radiotherapy, about what radiotherapy evolved as, what is it,